Hello, and welcome to Talk with HIROC. Today we're connecting with our friends from SickKids to talk about a new initiative just launched. Welcome.
Hey, Phil, how are you?
Why don't you tell viewers who you are and what you do at SickKids?
Dan, you want to lead us off?
Sure, that's fine. My name's Daniel Rosenfield. I'm a pediatric emergency physician, and I'm also the lead for virtual clinical strategies in the department. And Greg, you can give a little bit about you as well.
Yeah, thanks again for having us. I'm Greg Kennedy, the Director of Strategy at SickKids, and part of the reason that I'm here as well today is that I co-chair an enterprise-wide virtual care steering committee, which is in a way the brain trust for virtual care at SickKids.
Very interesting. Well, we often like to have shows like this where our subscribers can learn from other subscribers on what they're doing and hopefully take those lessons learned and, if possible, implement them at their organization. So let's get right to it. How did this initiative get started? Was it through patient or family feedback or a new idea from staff?
To answer that one, we have to rewind a couple of years, actually. I guess it was around 2018, 2019 in Ontario, all the right ingredients really started coming around to advance and scale up virtual care. There was shifting consumer preferences, the policy and payment environment in the province had really evolved, and the technology had matured to a point where the user experience was greatly improved. So seeing that recipe, our leadership team at SickKids asked us to convene a group of representatives from across the organization and develop a virtual care strategy. So it was built from voices across SickKids from a staff perspective, but we also did some really heavy surveying. We got survey results with respect to virtual care from about 1,300 patients and families, and drew pretty heavily on ideas from some of the patient and family advisory networks that we have. And from there, we put together sort of a 2 to 3 year game plan for virtual care. And one of the big projects that emerged from that was virtual urgent care. At the time, we were seeing really high volumes in our emergency department, and sometimes those were low acuity visits. And often in the GTA, families were driving past a couple of hospitals to come downtown to the SickKids ED. And so really from that soup of factors was part of that virtual care strategy. A real core pillar of it was to launch a virtual urgent care solution.
I would add also from the academic literature, there are a couple sites in the US who've launched similar programs, again, also in the past few years that offered a kind of both a starting point and a kind of roadmap of where you can go and how you can get, from the provider side, kind of acceptability and buy-in. So there are, some models to look after, and we've kind of have taken those as well.
That's fantastic. And I think you kind of alluded to it, Greg, but who were the people at the table you brought together to keep it momentum going, continue ensuring that there's transparency, feedback throughout the process?
Yeah, the answer is a bit of a funny one. So it was a committee that we initially formed from the staff side at SickKids, and I think we'd identified maybe about 13 or 14 people that, across technology, research, education, care at SickKids, where we had pretty broad representation. And people just started hearing that the committee had formed, and there was such a growing interest in virtual care. I think with every week that we approached the first meeting of the committee, we were adding like 2 or 3 new members a week. We also had a few family advisors that were sat on that core committee with us. So that, it was a group of, I think it started around 18 and ended around 30 people who advised on the initial strategy development. And then outside of that, we have a really fantastic network of patient and family advisors at SickKids, right from a children's council that goes, I think, age 9 up to 18, to a pretty broad range of family advisors. And we went back to them a number of times as we developed the strategy. So it really, really, truly was a virtual strategy built from the voices of our broad community.
And I would say so that's certainly kind of they're the overarching committee that's guiding principles, et cetera. At a more granular level, we'll talk, I assume, momentarily about what the actual initiative looks like. But in terms of who's involved, kind of the day-to-day, we again have been trying to be very broad. And the second you think you have everyone, someone chimes in, you forgot someone else. So from an operations day-to-day side, we've got a great project management team. In the emergency department, we're actually kind of coordinating with everyone possible, from our registration staff and coordinators to our physicians, our physician assistants, our trainees, like our fellows and residents, et cetera. So we're really trying to be as inclusive as we can. And there's a lot of interest, and people, it's impacting everyone's day, even if they're physically in the department and we're working virtually, there is still overlap. And so it's been very important to get kind of all these players to the table and to make sure they're aware of what's happening and where we're going.
No, that's fantastic. Having so many voices at the table is tremendous. But I guess more so is we all, many people know about committee work. Sometimes it can be kind of daunting, and there can be many, and you're like, but to have a waiting list to come on a committee is definitely speaks to the leadership at SickKids, and of course to the work that you both are doing. People want to. It's a hot spot. It's a great committee. So adding on to that now, so now we know that this committee is doing some great, amazing work. Tell the viewers a bit about the initiative itself and the process of how the program works.
Sure. So I can talk a little bit about the actual nitty gritty, and then Greg can chime in if there's any kind of higher considerations that I haven't been privy to in that sense. But the very short version is we were really trying to target a certain population of patients that come to SickKids and basically try and get them the care they need wherever that is. And that care, we know, is not always physically in the department at SickKids. We also know that parents are often looking for answers to what are often some straightforward questions. And of course, if you go on the internet and you go to Google, you're going to get given a lot of, I don't want to say misinformation, but it's not the best source most of the time. So what we were able to do in partnership with a third party was we've created we're calling it the digital front door. So as opposed to just kind of traditional urgent care, which is, book an appointment and see a doctor, this actually is a computer-based system where patients will start with their primary symptom. They'll log in, they'll say, I have a fever. And then they'll add a secondary symptom to that. A fever and my child is less than 3 months old. Well, that's actually an emergency. That can't be dealt with virtually. That needs to come to an emergency department. So they'll put those pieces of information in, and then the answer will spit out, you need to go to an emergency department, and provide you with local emergency departments for you. The next kind of level there is a complaint that should be dealt with in your primary care physician's office. So your pediatrician or your family doctor. So it needs to be dealt with. Doesn't need to be dealt with immediately, but needs to be addressed somehow. So again, you'll go through the symptom checker. You had an allergic reaction, you have some hives or something like that, nothing too severe. It'll say, follow up with your primary care physician in the next 24 to 48 hours. If symptoms change, come back to this or go back to your local hospital. And then the last one, which is the true virtual care, the last option is you're actually eligible for a virtual visit with a pediatric emergency physician from SickKids. So again, there are lots of different complaints that are eligible for this, but you go through the symptom checker and it says you're eligible for a virtual visit. At that point, you're then put into the family is put into a virtual waiting room. The provider, and we can talk about kind of how the provider works in a little bit, basically gets a notification, and they use this app that says, there's so-and-so waiting, this is their issue. And they use our regular Epic electronic medical record to document as well. And they see them just like we're seeing each other now. They deal with the complaint, and obviously, hopefully they can resolve it and keep them at home. But if they need to call in a prescription, if they need to bring them into to their local hospital, that's all possible and doable. And all the documentation is done within Epic to facilitate all that. So that's a very kind of high level overview. I recognize Greg and I have been in the weeds of this for so long now that sometimes some gaps might be overlooked. So as a relative newcomer, Philip, do you have any questions based on that, what I just described there? Does that kind of make sense?
It does make very good sense. And the funny thing is, as you were describing it, our CEO, Catherine Galton, and I were chatting last week about wayfinding in hospitals. And the way you kind of outlined it to me, I don't know why I went to that conversation that I had with Catherine about how it's so very critical and important for patients and families and staff and visitors that kind of know their way. And the way you spoke about, how there's a step-by-step process, it sounds to me anyways, and I haven't used it, it sounds to me that it would be helpful for the user to really understand and know, okay, I put in this, I put in step 1, I've put these information, here's what could happen. And step 2, oh, you know what, I have to go to the ER, it's telling me. And so that there's no doubt. And I think that's what I feel like what you described to me, it helps ensure that there's no doubt for the user.
Well, that's the informal fee. Again, we've only launched a few weeks ago, and we're obviously going to do a robust evaluation, both talking to families, talking to providers, et cetera. But even from the informal feedback we've gotten to date, that's actually been one of the biggest things. It's just, I feel much more confident in my decision to go to an emergency department and wait, especially in COVID, where, nobody wants to go to any emergency department regardless, even though they should a lot of the times. So it reaffirms the decisions that were thought of. It often changes things like, oh, I didn't think I could see my family doctor about this. And it also lets us as SickKids providers kind of reach outwards and say, this is what we can do, this is what we won't do, because I think there are some perceptions about care that can be sought in an emergency department that isn't always emergent, and so we can clarify some of those via our symptom checker. Greg, was there anything else you think I've missed there, or anything kind of higher level that the viewers might be interested?
I just think on the long view of the model, Dan described it as a digital front door, and that's exactly how we're looking at it. Your analogy, Philip, is a really good one, wayfinding, but it's almost upstream wayfinding before someone arrives at the hospital, and it can do that system level traffic control in getting people to the right place. So in the current system, there's 3 branches that Dan described. It's directing you to primary care with some educational supports, coming to your local ED, or the virtual visit with an ED provider. But the long view on that model for SickKids is that we can add branching into that front door over time. So we have a number of other services across the organization, many of which are offered virtually. And the hope is, once we optimize this virtual urgent care piece in those 3 branches, we can start layering in additional branches. Because I think historically, a lot of other healthcare organizations, like we did, used to think about virtual care on a use case by use case basis. So depending on the service or patient population, they'd stand up a software solution to meet a need. But as virtual care scaled up, and especially when COVID came and it really accelerated the scaling, that ended up a bunch of different logins, a bunch of different user experiences, bunch of different learning curves, both for family and providers. And so this move was really a first step for us in setting up a platform, a digital front door that can eventually host a unified suite of virtual care services. So it'll be the one-stop shop if you need SickKids services to come in through that under a much more streamlined user experience.
Yeah, and we've actually had some experience with different clinical areas from the emergency department, and Greg can speak to the ambulatory kind of regular clinics as well, to figure out what does work, what patient populations virtual care, is great for. Some of them, early in the pandemic, we were trying to do as much virtual as possible, and it worked well in some cases and not so well in others. One example is we were doing virtual, what we called consults in the emergency department with lots of different services. So if a kid was physically in our department but needed to see for example, our kidney specialists, they didn't need a physical exam from them because they already had one from me. They would actually just see that specialist virtually. So that worked well for some ideas. And one place that took off on was for mental health. So psychiatry has been doing a ton of virtual consults and virtual clinics. And that's likely something that will have the ability to potentially expand, especially given the recent increases in demand. And so that'll be just one piece of this kind of like scaled up digital front door that will sort of evolve over time, I'm sure.
I love the concept of the digital front door. It's in my head already, maybe as a communicator and, the work that we do, I can already see it. I can see everything like, let me peer into the door and then I'll know exactly. And then there'll be a welcoming hello from the staff at SickKids. So I love that concept. So building on that for our subscribers, what's one piece of advice you can share with our subscribers when it comes to planning and launching, a virtual urgent care program like yours or a virtual care program in general?
You want to start us off, Dan?
Sure. I mean, I'll start at a more granular level again, because I've been more in the weeds from that end, and I'm sure Greg will probably agree with it based on what we talked about earlier. Is actually bringing everyone to the table early and asking to kind of snowball who have we missed? So when we were starting just discussions in terms of, it was very kind of provider centric. So it was very much, have we talked to physicians? Have we talked to all the physicians? Have we talked to the physician assistants? And no, people didn't get neglected, but there were definitely times where I thought, I thought something would work and I forgot about the manager in the ED, or I forgot about the registration clerks, or all these workflows impact everyone, even if you don't think they do. So it's always important to bring everyone to the table early, let them know what's happening, frequent updates, with obviously trying not to over manage and give information overload, but at the same time, offering those touch points and making sure you communicate what the plans are and where they're going, because invariably there were lots of emails of, I didn't know we were doing this, or how I told a family this didn't exist. How did, so everyone wants to know and everyone's very interested. And those same people are great allies in terms of kind of building excitement about the program. So, telling, most of our bedside nurses, this isn't going to impact, but all of our bedside nurses have families that they can tell about the program and great ideas for improving and making more innovation. So I've gotten lots of great feedback just again in the halls, the only place I can be at work in the halls still, and that's going to help us moving forward. So that would be the kind of one tip I had from the view I've had to date.
Yeah, and I'd probably add two other angles to that. One is taking the long view on setting up a solution, and two is the health equity impact. So regarding the first part on taking the long view, again, I sort of alluded to this already, but we used to think about virtual care on a use case by use case basis. And I think, especially with COVID, with the scaling that has happened, I think organizations really need to think about how their whole suite of virtual care services are integrated, and really building those around a unified user experience for patients and families, but also for providers. At SickKids, we see pretty complex patient population, and patients and families might cross a lot of different services, and so might providers. So having it so that the login is easy, the user experience is very user-friendly, it can be a real game changer for the success of your comprehensive virtual program. And it also can reduce software licensing fees, all the privacy risk legal assessments that are necessary to stand up a solution, all the training and maintenance that needs to come along. The more that you can integrate those, the more efficient you can be. And then with respect to health equity, I think with digital health technologies in general, this should always be top of mind, that at every step of the way in the design of a solution, you're considering what the health equity impacts are. When we developed our virtual care strategy, one of the guiding principles was that we commit to equity of access. And it was really interesting when that strategy development work evolved. There were some camps of people who really thought that if people didn't have access to the digital technologies you needed to participate, that could really breed inequities. And then there were people at the other end of a spectrum that thought, when you eliminate the need for transportation and time off work and all these other factors we know might hurt health equity in terms of access, the real answer, we don't really know that yet until we've implemented these technologies and matured. So what our commitment is, and Dan mentioned some pretty robust evaluations happening, is kind of shining a light on equity at every step of the way to ensure the diversity of our patient population, the languages, and their ability to access solutions is equitable now and as we grow.
The one great thing about the digital front door is that we're going to be blessed with a trove of data from who's accessing it, how they're accessing it, how much very granular stuff that's probably going to be way too much at front, but how long they're in the system, et cetera. And we're making one of our focuses is to make sure we get data for not just who accesses it and goes all the way to the conclusion, but who accesses it and abandons it. Why did they abandon it? That sort of thing, to figure out, is it because English isn't their first language and it hasn't been adequately translated? Is it because they didn't think that they could access SickKids because they were too far out of the catchment area? There's so many layers here. And so that's one of the interesting research and equity questions that we're hoping to answer, hopefully pretty soon.
That's a very great point you bring up, Dan, about the the process, and then where the user may abandon the process. That'll definitely shine the spotlight on where greater efficiencies can be created throughout the process. But those are some really great, valuable tips for the viewers. I took a whole bunch down. So making sure you bring everyone to the table, taking a long view to ensure that the user experience is integrated throughout the process at the organization, and of course the great value in health equity. Those are really good points you guys brought up. So what's next for the program, for the team?
Well, practically, I mean, we've just launched just a few weeks ago. So I liked Greg's last point about taking the long view. Again, being in the weeds, it's harder to take the long view because I'm really focused on the day-to-day, getting it working, getting the workflows in our, the people working on it to get adjusted to it. Because while our group is fantastic at change management's always very difficult. And so we're really just pushing that forward. We've got lots of strides to make in terms of getting the data for health equity, expanding who's eligible. Right now, only previous SickKids patients or who visited SickKids before are eligible for virtual visits, and that's obviously something we'd like to expand. And certainly with Greg alluding to the long view, there are lots of other places this can expand to. So really, from my angle, it's just making sure everything's running smoothly, getting feedback from our providers to make sure there aren't any glaring deficiencies, and then to speak with Greg and other leadership in terms of what the big pictures are.
Yeah, we've really started shouting it from the rooftops, but in the media landscape right now, so much is focused on COVID that when we initially communicated it through our social media channels, it probably wasn't as loud and as far-reaching as we wanted the new services there. So I think it's important to really keep communicating it so that across our region, people know that it's there, they know that it's reliable. And we can start increasing the volumes we see on the service. And then beyond there, just my team and I thinking about, what's the next branch that we build in so that we can start picking off other virtual care solutions that we offer at SickKids and pulling them in to this wonderful user experience for patients and families.
And the communications part is where we come in. We really do love partnering with your communications team to amplify stories like this. I heard about the story from Dan when you guys were like you guys were mentioning, in the process of creating this amazing initiative, and I was like, wow. And I don't have children, and I was like, wow, this is like an amazing initiative. I need to know more about it, but I also need to tell our subscribers about it because this is something they can totally scale at their organization, and HIROC will be happy to link to you guys at SickKids. So adding on to that, something I have noticed, working closely with all our good friends at SickKids, no matter who they are. And last year we interviewed Dr. Cohn, and something I've seen, everyone I've interacted, is this culture of wanting to do new things, innovative, and of course that culture of caring for your patients and their families. So I guess I'll kind of ask you both, like, where do you both get that motivation, that energy, that drive to keep pushing forward? And throughout, we all know what very difficult times right now and challenging times, like where do you get that motivation and energy?
Greg, you can kick us off.
Sure. So for me, I used to work across the street from SickKids at Princess Margaret Hospital, and it is interesting that you mentioned you pick up that kind of intangible culture, because SickKids had a better food court. So I used to walk across University Avenue and I would eat lunch in SickKids. And it was almost something that you couldn't put your finger on, and an energy in there. I do think it's because it's all wrapped around children, and there's sort of so much hope and optimism in their imaginations. But really, it is a culture around the organization that is there to help children and families that across the board, we're so mission driven that it really helps to draw people who are behind that mission and all want to push in the same direction to help the children and families that we serve.
Yeah, and I'd agree 100% with that. I mean, obviously for me as a clinician, I chose pediatric emergency, and then I was lucky enough to get hired on staff at SickKids because the kids are the best. Like that's always been my interest and drive and everything. So, and there are lots of fun. Obviously, there's challenges in the emergency department when kids get sick, and throughout COVID, we've been lucky that the majority have done better than their older adults like us counterparts, which has just been luck, but very fortunate. But the follow up to that is that when you're working with them, the people who are attracted to working with them are in the same boat. So whenever I talk with my colleague, my medical school classmates who kind of ended up elsewhere or in other institutions, and they tell me about some of the trials and tribulations they face, I often I don't say much because I often don't have the same issues. Like the people who we work with, I've heard Dr. Cohen say it, and I know leadership says it, the people make the institution, and the vast majority of people I work with are just fantastic people, and they make doing this sort of work easy, because we all, the common goal for improving health for children is easy to get behind, and the kids are great, and so it makes doing all this all the more worthwhile and easier to do.
That's fantastic. And so, viewers, please do let us know if you want any more advice, suggestions, feedbacks from our friends at SickKids. Thank you both, Dan and Greg, for taking time out of your very busy days to connect with subscribers and let them know about this amazing initiative. We truly appreciate it.
No problem. Thank you for having us.
Thanks so much. Thanks for having us and for helping amplify the message.
We're here for you. Thanks again, viewers.